Welcome everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 13 new cases of COVID-19 in Windsor and Essex County. 4 are close contacts of confirmed cases, 5 are community acquired, 3 are outbreak related, and 1 case is still under investigation. We have had 16,708 cases since the beginning of the pandemic. 131 people are active at this time, with 60 of our active cases being a variant of concern. To date, 1,901 preliminary or confirmed variants have been identified in Windsor-Essex County. 12 people are currently in the hospital and 2 people are in ICU. Our community has lost 433 people to COVID. There are currently 5 active outbreaks in Windsor and Essex County, 3 workplaces, and 2 community outbreaks. Regarding our vaccination rollout, 328,358 doses of a COVID vaccine have been administered to Windsor-Essex County residents. 263,566 people have now received at least 1 dose of a COVID vaccine. Overall, 72.2% of adults 18 years of age and older in Windsor-Essex have received at least 1 dose of a COVID vaccine, and 18.7% of adults over 18 years of age and older are fully vaccinated with 2 doses. Residents of Windsor-Essex County 12 years of age and older are able to book their vaccine appointments for their first dose at one of our mass vaccination sites. Please note that select pharmacies and primary care providers are also providing vaccine. Seniors 70 years of age and older are able to book their second dose appointments. In addition, those who received their first dose of a vaccine up until and including April 18th are able to book their second dose at our mass vaccination clinics. Those who received AstraZeneca 12 weeks ago are also able to book their second appointment. For those who would like to receive a second dose of AstraZeneca, please contact your pharmacy or healthcare provider where you received your first dose. There are now 55 pharmacies in Windsor-Essex County giving out AstraZeneca. To book an appointment at a mass vaccination site, please visit wevax.ca or call 226-773-2200. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. So today is Friday and we'll just go right into our epi summary. I was waiting for it. I hope everyone else was too. So quick look at the situation in Ontario, and we continue to see a downward decline with respect to number of cases in the province, and now from a provincial case average perspective, we are even lower than where we were before the beginning of the third wave. So things are definitely moving in the right direction, and many factors playing in, including the vaccination rollout. Similar picture in our community. We continue to see an ongoing decline in the number of cases, and more pronounced in the last week. Putting those 2 slides together, so we can see that the provincial average as well as our local average continues to go downward, and they're all pointing into the right direction. So how does that translate into week-over-week case rates? So this slide basically shows that, and just to make sure that everyone understands, when this particular slide basically shows a full completed week, which ends on Sunday, and this is what it looks like. So overall, our most recent completed week's rate is 29.9 cases per 100,000 population. Again, this is a decrease from where we were last week. And then if we just focus on the last 7 days, that includes up to yesterday, our case rate is 23.5 cases per 100,000 population. So significant decrease from where we were before 2 weeks ago. Overall, in the southwestern Ontario, province of Ontario, everything is pointing it down in the right direction, thanks to the vaccine and everything. Looking at our wastewater surveillance data, so just as it's another measure that we use to see what exactly is happening in the community through the surveillance of wastewater data. And this is helpful for us to understand that whether the cases that we are seeing, is it reflective of what is actually the true number of cases in the community? Because if, let's say, for example, if we have a significant number of population that is not getting tested and they're still infectious, but if they're shedding the virus, which everyone does, in the wastewater, it will be picked up. So now looking at what we are seeing in our community, the wastewater surveillance data, it's also showing a continuous decline in the SARS-CoV-2 viral count, and it aligns very well with our case rate. So showing that what we are looking at the cases, those are the actual cases in the community. But again, just a word of caution that this is still a new experimental methodology that is being used and it requires validation. So there, just as a word of caution, but so far it has aligned really well and shows that what the true picture of the community looks like. Looking at our percent positivity and overall, in total, 358,797 tests were completed in Windsor-Essex as of June the 5th. And again, this slide shows completed week, which ending on Saturday. And this week, our percent positivity was 3.0, which was another decrease from the last week when it was 3.4%. And in total, last week, approximately 4,385 tests were completed. So that was completed week. Looking at just last 7 days, what's happening across the province, and this is what it looks like. So unfortunately, we are seeing high positivity, especially in one smaller health unit, Porcupine, and then the rest of the region is still showing a significantly positive case rates. Windsor-Essex is below the provincial average, and we are somewhere right in the middle of the pack at this time when it comes to percent positivity in just the last 7 days. And right now, our percent positivity in the last 7 days was at 3%. So breaking it down, these percent positivity among the different age group, what we can see is the percent positivity is slightly higher in the younger population, 0 to 17, versus the older population. Looking at the cumulative regional and provincial rate, our regional and provincial rate continues to be, we continue to be at number 4, and a lot of those cases, as we know, were from the first and the second wave, and the third wave was really mild in our community, and we basically are still continuing to move in the right direction, while some of the other regions are their case rates are increasing. So breaking it down with respect to each of these municipalities, and what we can see, this is just from June to present, so basically 10-11 days worth of data. Majority of these cases are coming from the city of Windsor, followed by Tecumseh and Lakeshore, while the rest of the municipalities are also mentioned here. From a distribution perspective, in the last month, 77% of our cases are from the city of Windsor, and the other notable municipalities are Lakeshore, LaSalle, and Tecumseh. Similar picture in the last 7 days, with just more pronounced impact in the city of Windsor with 81% of the cases. So this graph gives you a breakdown of age and sex distribution, and we can see almost 35% or 1/3 of our cases are in the younger population, and this is mainly because of the low vaccination rate in this particular group. And we just opened this vaccine eligibility for 12 to 17, so hoping that with more and more vaccination coverage, we will continue to see a decline in there. And then the rest of the age band is coming pretty much close to where we were before, indicating that the vaccine it has impacted the vaccine coverage rate has impacted the rates in each of these categories, and it continues to decline based on the vaccine uptake. From an exposure perspective, not a lot of difference. Still, we are seeing majority of the cases in the close contact and household close contact, with some coming from the community, and we're hoping that we'll continue to see a decline in the community transmission, and that would help us to further strengthen some of these public health measures. So still right now, the community transmission is roughly about 36%, which is again almost 1/3 of the source of acquisition in our community. The percentage of daily variant of concern cases, it's still we're seeing more than half of these cases, and ranging anywhere between 60 to 80%, or sometimes even 90% of the cases coming from the variants of concern. So it would be eventually will be the dominant strain that we are looking in our community. So every case is most likely to be a variant of concern, and that's why getting the vaccine is critical, as well as ensuring that you are continue to maintain some of these public health measures, such as maintaining your physical distance and trying your best to stay within your household as well. And that's the only way we can bring these. We can keep our community protected, and we will give less and less chances to the virus to find a susceptible host. And once our active cases, our cases circulating in the community will go down, we'll be in a much better position. A quick look at the hospitalization rates, declining everywhere in the province, in Windsor-Essex. Similarly in the ICU, similar picture, everywhere it's declining. From a case fatality perspective, just a quick look here. So obviously our case fatality rate was slightly higher than the province. But when it comes to the long-term care home and retirement home, it's less than the provincial average. So mainly our community has seen some cases, people dying as a result of COVID in the community, maybe slightly higher than the provincial average. Looking at our case doubling time, and again, this is an indicator that how long it is taking for this virus to double the number that it currently has. So we are moving in the right trajectory. The province is moving in the right trajectory. The Canada as a country is moving in the right trajectory, and the case doubling time is increasing, which is a good thing. And we continue to see some of these fluctuations, but overall, we are still better than what's happening in the province and in Canada. Our most recent estimated median R0 is 0.84. This again means that the number of new cases are less than what the current number of cases are, and it continues to stay the same, which means that our cases will continue to decrease in our community, and that's the hope, and we're really looking forward to seeing further reduction in the number of cases. So now talking about the vaccine status data, and just a quick look globally. And just recently, we have surpassed the one dose, at least one dose population, even surpassing the Israel, which many countries have seen as the country that has provided the most of the vaccine in such a short period of time. And as we can see the graph, Canada started slow, but we picked up really well, and we just basically come across from the bottom to almost at the top, beating some of the other countries, including US, UK, and now even Israel. We just completed that. So just focusing in Windsor-Essex, so we continue to see an increase in the number of doses that are given out in our region over the time, and looking at the month of June, and now we have shifted more and more to the second doses primarily, and there are days when we are giving out more than 6,000 doses of vaccine in Windsor-Essex. And overall, when we are looking at it, I think we are we'll see how the moving average looks like. But just yesterday, and I reported it a couple of days ago as well, just yesterday, more than 90% of the vaccine administered in our area was second dose. So clearly we are making huge progress in giving out second doses to our community, and we're keeping them safe by fully vaccinating all our residents with 2 doses of the vaccine, and with more and more vaccine coming in, we will continue to vaccinate our residents both with the first and the second dose to keep them fully protected. So our daily doses administered and the 7-day moving average continues to move upwards, and in the green line, as you can see, and most recently now we are sitting at 5,100 doses a day that is given out to the Windsor-Essex resident. And again, this also includes some days when the vaccine uptake is slow on Saturdays or Sundays, but overall as a community, our vaccine uptake is increasing, and vaccine being distributed every day. Those numbers are increasing, and it's a great opportunity for me to remind anyone who's still waiting to get their first dose. please get your first dose as quickly as possible so that we can all focus more on the second doses piece and keep our community protected. Looking at our coverage rates by various population, and if you can see, we continue to use a number which gives us better and better coverage. So right now, when we're looking at the overall coverage, it's 60% in the entire Windsor-Essex, and that includes everyone, and by everyone meaning even a month-old baby or a year-old baby who are not even eligible for the vaccine. So that's what we are talking about when we are talking about the overall coverage, 60%, and it's a huge milestone for us that because we were hoping that between 60 and 70%, that's the target that we will get from an overall perspective, and we've already achieved that even when the vaccine is not eligible. Or the vaccine is not available to children younger than 12 years of age. So we have covered that, and we really hope that we continue to move in that direction. And then when we are looking at the coverage rate and just focusing on anyone who's 40 years and older, whether they have received at least one dose, and that is almost 80%, so that's 79.6% or roughly 80%. So it's a pretty good coverage rate in that age group, and we really want that it translates it down further to the younger age group, so that we as a community can feel much more confident in building that immunity in our community. And just a quick word of comment on the 12 to 17 years of age group. So far, our coverage rate is almost 41%, and clearly there's a lot of room for improvement. In that age band, we know that vaccine is available to them, and we have done some targeted clinics for them, and hoping that before the school year starts next time for fall, we are able to provide them with 2 doses of the vaccine. So this is a cumulative picture of percentage of population with at least 1 dose by age group, and it helps to see where the vaccine uptake in each of these age bands. And as we can see, among the older age group, we have a significant number of people who are already vaccinated with more than 90% or close to 90% coverage, and showing the plateauing effect. That means basically that we are coming close to the saturation point in that particular age group, but there's definitely a room for improvement in the younger age group, and we hope that everyone take that opportunity to continue to get vaccinated. And so this is so we were talking about the first dose. This is for the 2 dose, our fully vaccinated age group that we are looking at. And as we can see that the highest age group or the highest coverage with fully 2 doses vaccination is among the 80+ population, because that's the group that we started earlier. And we can see that almost 75% of the 80+ population are now fully vaccinated. We want to make sure that we give them 100% vaccinated based on the whatever their initial uptake was. It was 93, 94%. So we want to give them, make sure that they have all received full 2 doses and they're fully protected. So right now it's 75%, and the second largest group we can see is between 60 to 64 year age band, and that's close to 36%. And just a quick data note that this number is high because a lot of these individuals received AstraZeneca, and because of the expedited schedule, that's why you're seeing that number slightly higher than the other age bands, and then the rest of the age band is reflective of what is available versus what is not available. So we open it up for anyone who has received the vaccine April 18th or earlier, so they're all eligible, and we'll continue to see the coverage in that area. So in our hotspot community, what we are looking at is, again, a slightly lower than what our overall community picture looks like, with some key areas continues to be N9A, N9C, and then N8X, clearly indicating that more work is needed in that area, and hoping that we're, through the partnership of various organizations and in the community, we should be able to do more targeted targeted outreach to this community, to get them engaged, to provide them the support that they need, to ensure that they're not only following the public health measures, but also getting the vaccine as well. The location of doses, no surprises there. Our hospital-based clinic have distributed more vaccine than any other setting, and they were doing the vaccination from late December all the way up to now, followed by our public health, and even with the second doses, we can see that the distribution of second doses is also continues to increase in each of these areas. From a vaccine type administered, clearly our workhorse vaccine continues to be Pfizer-BioNTech with majority of the vaccine, but now you can see that we have a significant number of second doses are being given out. Even for AstraZeneca, we have used 37,000 doses as first dose, but in just between the last few weeks or a couple of weeks, we have given out 11,000, more than 11,000 doses of vaccine. So recognizing that still there are people who are waiting to get their appointments, but with more and more shipments coming for AstraZeneca, those vaccines are being given out, and it's great to see that people are continuing to use the second dose as their of the same vaccine to ensure that they are fully protected. So that's great to see. And then from a distribution perspective, by each vaccine type, so 70% of the vaccine that was given out is Pfizer-BioNTech, and 15% each for Moderna and AstraZeneca. So just to give you a quick look in terms of what vaccine are given out every day. So it's a combination of all three vaccine, and even in the last few days, as you can see, AstraZeneca vaccines are given out in our community. So as more and more supplies are coming in, we continue to give out those vaccines out to our community. So in summary, our case rates continues to decline in our region, which is really a great sign. Our hospitalization ICU continue to decline locally as well as in the provincial system. Our wastewater surveillance data has continued to decrease in the past week, and definitely aligning well with our active cases and our daily reporting of the cases. Our vaccine uptake has increased to 60% for first dose, and this is a slight increase from the last week, when we had 57.8% of the first dose vaccination. And when we are focusing on the second dose coverage rate in the 80+ population, it's now gone up to 75%, and this is up from last week when we had roughly half of that percentage, like 32.6% last week. So overall, all good signs. And then when we are looking at the summary monitoring indicators for Windsor-Essex, completed week 29.9 cases, but just in the last 7 days, it has gone further down, 23.5 cases. Percent positivity also is continuing to decline in the last week, 3%, and our R effective also continues to be stabilized with 0.84. And today, as we know, that the province have moved every region except for one to step 1 of the reopening, and we really hope that people continue to follow some of these measures to keep everything safe and keep everything open. We definitely don't want to be in the situation where we start to see an increase in the cases. So please follow some of these guidelines to make sure that we continue to stay open. Nobody wants to go back to a situation with high case rates. Get your vaccine, make sure that you're following some of these measures, and then we can all enjoy a great summer in Windsor-Essex. Thank you.
We'll now take questions from the media. Today we'll start with Blackburn.
Yes, good morning. Dr. Ahmed, you mentioned that in the last few days, one day it was 84% were all second doses. I think you mentioned yesterday was around 95% second doses. Do you think we're reaching that plateau overall of the percentage of people who will intend to get vaccinated?
Well, we're coming close to that mark, and that's why I think we continue to send out this reminder messaging, because even from our planning perspective, it's important to know that who are we targeting? Are we targeting for first dose versus the second dose? I was hoping that we should see at least 70% coverage in each of these age band. We need a good mix of coverage across all the age group, because it really helps to to paint a better picture for the community. Even if we have, let's say, 100% vaccination in one particular age band, but in the other band, if it's not the same, then we are giving those susceptible people or susceptible hosts or the virus an opportunity to infect them. And if the virus continues to find that susceptible host to infect them, it will continue to be a problem for our community, and the virus will continue to circulate in our community. So that's why we want everyone, and even, you know, if you're seeing that the case rates are declining, then what's the point of getting the vaccine? No, that is exactly the point. If you're getting the vaccine, then you will continue to see those decline in the cases, and the virus will not have a viable host to survive. So it is more than important for everyone to get the vaccine, get our coverage rate high, and keep our community open.
And yesterday, as part of the province's announcement of the expanding eligibility for certain health units, I know we weren't part of that, but later in the news release, it did say that they're giving people the ability to register with their health unit if they got the vaccine outside of the province or outside of the country. Have you worked out how that's going to work for the Windsor-Essex health unit?
So I'll pass it on to Teresa because we were doing some work. Over to you.
So we are looking at how we can accommodate that, and we are using some dedicated staff, two of our staff who have access to COVAX and have the ability to document this. So right now we do have about 10 people that require another dose, and we need proof of documentation that they've received their first dose. So we're just working through the logistics and hope to have a better process in place. But right now it's basically a phone call and confirmation and reviewing all of their information and then booking them at a clinic.
So even though the province announced that people could do that, they didn't give you any resources in order to do that?
So in COVAX, they have the ability, so the COVAX system is the provincial system, and so with the ability to add people into the COVAX system is pretty significant, and they've asked health units to lead that process because you do need special access for the COVAX system to do that. So that's why we've dedicated a couple staff who have that access, and we'll be working through to streamline the process for our residents. But basically, access to the COVAX system was key to getting all this in place.
Thank you.
Any questions from the Windsor Star?
Teresa, yesterday the number of new cases was 7 single digits. Do you know the last time we had a single digit new case increase, daily new case increase?
I don't, because it seemed like it was so long ago. We would have to look at that, but I know Dr. Ahmed is trying to search that out right now, but it has been a long time.
Okay, I guess I'll just wait until that information maybe it's available.
Yes, we'll look for that.
Nothing further, thank you.
Any questions from AM 800?
Teresa, can you share with us in regards to the community outbreak that was declared yesterday at the church? Is it a number of cases that are being reported at the church?
Yes, I can confirm that there are a number of cases that we're investigating and contacts. So that's accurate.
Was there a church service happening at this time when the outbreak was, I guess, when these cases popped up?
No, there's all sorts of circumstances, and we're looking at all of that, but it's not related to a specific service.
Okay, thank you. And sticking with the outbreaks, is there any updates in regards to the Southwest Detention Center? It's been under outbreak status since late April.
So we don't have any additional information. We know that they're, I believe it's into next week if all goes well, that we're just that period where they cannot have any new cases and that would take them out of outbreak. And so I believe that date is looking, today's the 11th. In my head, I have the 20th, but that could be too far off actually. So nothing new on that except that, you know, everything's being followed. They're doing well and we're just waiting for when we can rescind them.
Thank you. One question for Dr. Ahmed. Dr. Ahmed, you mentioned the hotspots in your presentation. Is there, not sure what word to use here, concern? Because I know you and the team, Teresa and her team, even Windsor Regional and other officials are trying to get out to these hotspot areas to assist individuals living in those postal codes. Is there concerns that some individuals are still not getting the vaccine?
Yeah, no, absolutely. I think it is a concern because you know, when from a health equity perspective, from the social determinants of health perspective, these neighborhoods are identified because of many of these determinants of health, social determinants of health impacting them, such as income, level of education, immigrant status, all those things. So it does play some role, and historically with all of these health related issues, we see that the communities that are impacted more by these social determinants of health have a worse health outcome compared to the rest of the community when you have a higher social determinants of health, or all of these like factors such as education, income, employment, language, and all of those things. So it is historically that has always been the case, and that's why there are some concentrated efforts that we like to see through our community partners in these areas to target them and to provide them with the tools and resources to eliminate all these barriers for accessing healthcare, accessing testing, accessing vaccine, accessing employment, providing them more opportunity for them to education, removing any of the language barriers. So all of those work is critical, and hoping that some of the community agencies that are already in the ground working with this population, they will continue to engage them, and everyone as a community, we can move forward. We definitely, and I've said this many times, we definitely don't want to leave anyone behind. We want to make sure that everyone is moving forward, and we can, you know, look past this pandemic and get back to in a better state as a community. So it is a concern, but hoping that with some of the partnership that we have right now and some of the agencies that are getting some of the additional funding, we should be able to target these communities in a better way and to provide them with the tools and support to move forward and have better health outcomes.
Thank you.
Any questions from CTV?
Yes, good morning. Do you have the numbers for the new deaths and hospitalizations this week, if they were vaccinated or not?
We don't necessarily track that information that way, but and again, I think there was some report that we presented, but I don't have that in front of me, at least at this time. Those numbers continues to be very low. It's not that high.
Okay. And were you surprised that Windsor isn't a hotspot for vaccine eligibility anymore, or was that expected since the Delta variant isn't prevalent here?
Well, it came as a bittersweet news to us that, you know, obviously it was good that we are not identified as a hotspot anymore, but also, you know, as we have always done, myself, Teresa, in all of these conversations with the ministry, we advocated for getting more and more vaccine for our community to make sure that, you know, we are doing our job to give the head start to our community that we need and to keep everyone safe. So we didn't get the additional vaccine, which is fine, and some of the areas probably deserve it more than others. So we're happy to be you know, moving in the right direction, especially with our cases. And I think we are still getting a significant number of supply of vaccine, and we are anticipating that there will be more vaccine coming our way. And the sooner it arrives, we'll continue to push it out as quickly as possible. Yeah.
Just want to get back to
what is your message to the community on day one of step one of reopening?
I just want to get back to that one question about our last time we reported single-digit cases. It was March 15th, and we reported 8 cases on that day. So I'll let Dr. Ahmed talk about the reopening.
Yeah, so
Thank you.
so my message to the community as the first day of reopening is, enjoy what's available to you, enjoy the outdoor, enjoy the patio if you're doing that, if you're going out in the community. Make sure that you still keep that in mind, that that the pandemic is still not over. So it's in a much better state right now in Windsor-Essex. We'd like to keep it that way, and the only way we can keep it is if we follow still some of these guidelines that we talk about, limiting to the number of people that you're allowed to connect with, ensuring that when you're going to the patio and everything, you are not sick, you are not told by anyone to isolate from a public health perspective, you're not quarantining, and if you're sick, stay home. So overall, I think it's a good time, it's a good weather to be out, and there will be a lot of people outside. So make sure that you use that opportunity and do it responsibly to keep everyone safe and keep our community safe.
Okay, thank you.
Any questions from CBC?
Yes, that plateauing effect with regards to the vaccination rate and people getting first doses, do you think that's happening specifically with the younger population right now, or is it too soon to tell?
I think it is still too soon to tell, because there may be some further uptake, but we know in general from a vaccine hesitancy point of view, if you want to call it, it's some of these younger generation, and partly because I think they haven't seen the devastating impact of some of these deadly infectious diseases that a lot of people have already seen in the older age group. Measles, mumps, those are not right now, no one talks about them, and the reason no one talks about them because we eliminated those diseases by having a very high vaccination rate. Before the vaccine, people were dying with these diseases all the time. With vaccination, we overcome that. We're hoping that COVID, once we get all these vaccines for COVID, the virus will have no viable host and will continue to be eliminated in the entire world. So it is a group that hasn't seen some of those impacts, and I really hope that they get the right information, they get the vaccine, and we need good vaccine coverage in every age band, and that's important. So we hope that we'll get a higher coverage rate in all of these population. If they have any question, do not hesitate to go to our website, get all your questions answered, talk to your healthcare provider, go to the credible website. Stop going to this conspiracy theory websites or misinformation that's been out there. Go to the credible website and get the right information that you need. Our indication of success is evident. With high vaccination rate, our cases go down significantly. The age band that is vaccinated, we're seeing that the new cases in that particular age band is going down significantly. That's the proof, that's the data, that's the information that is right in front of you. Everything else, it's nothing but misinformation.
In terms of the strategy to get the population vaccinated, do you think that our coverage rates would be higher right now if schools were still open and vaccinations were taking place in schools?
I don't think so, because even when we're talking about it, the vaccinations are happening in the schools, you would require a lot of resources to go to each of these schools and vaccinate. A lot of these resources are already stationed in these mass vaccination clinics. So from a resourcing perspective, the children going to the mass vaccination clinic is great, but also there are more opportunities for the family doctors, primary care providers, the pediatricians in our community. They can play a good role in communicating the information to the parents, to the children, and getting them vaccinated. Public health and we did that session especially for the parents of younger children to talk about the vaccine, to talk about the risk and benefit. And I am a parent myself too. I have a 14-year-old and I have an 11-year-old, and I had to answer to them as well. I have to think about them. I have to care about them. I cannot imagine that if I feel uncomfortable about anything, I would, for my children, I won't do it. So my job is to make sure that I get the right information, and just for everyone to know, I got my son vaccinated the moment he becomes eligible, just for the reason that I wanted him to be safe and do his part. And my 11-year-old asked me this question regularly: when am I getting the vaccine? And I don't have an answer for him yet. So please take that opportunity. These vaccines are safe and effective, and that's the only way we can move forward. The long-term public health strategy is to get everyone vaccinated and to keep our community safe. So I hope that anyone who is still thinking about the vaccine, please get the vaccine.
Thank you very much.
Any additional questions from Blackburn?
No, thank you.
Any additional questions from the Windsor Star?
No, thank you.
Any additional questions from AM 800?
No, thank you.
Any additional questions from CTV?
No, thank you.
Any additional questions from CBC?
Yes, Oscar, I know you're pleased with the progress that's been made getting case counts down. I also know that regional medical officers are able to impose restrictions over and above what's set out provincially. So I wanted to ask, are you comfortable with all of the aspects of the step one reopening? Is there anything that you are considering changing or modifying as we go forward?
Well, I think this is an ongoing assessment of the risk for our community, and based on the ongoing assessment of the risk, I think I don't have anything in particular to impose to our community. And if there is anything that we pick up based on what we see in the community, and if that changes our risk assessment in some way, we should be able to provide recommendations appropriately. But on the flip side, when we're looking at the case rates going down in our community, with the vaccination rate going up in the community, we should be soon seeing more than 20% coverage rate of vaccine with second doses in our community. I think maybe we should be in a position to make an opposite case to say, hey, maybe can we move forward earlier than what the provincial plan looks like. So there is both sides of the story, and would like to see how the reopening that's happening today will have an impact on the community, and how the community is reacting to it, and if it's the right number, if it's the right thing, and if there's any opportunity for us to advocate for our community, we will do that.
Thank you. And just to be clear, you can make restrictions, but you can't loosen them. Is that correct? Under the current regulations?
That is absolutely correct. Thank you for mentioning that. I can make the restrictions more, but I cannot ease some of these restrictions. The province has to lift some of these restrictions.
Thank you. And one final question. So that date of April 18th, the minimum window for second doses right now, does that apply to mass vaccination sites as well as primary care providers and pharmacies? I'm asking because I've heard of at least one clinic locally that is offering vaccines to anyone who had their first dose more than 28 days ago.
So the eligibility right now is that people that received their first dose up to and including April 18th. The other, and I'm not sure exactly which facility you're referring to, but people 70 years of age and older are also eligible. And so it is possible that if they received their vaccine more than 28 days ago, they would also, if you're 70 and older, you would be able to get your second dose. But everyone else, would not be eligible for a shorter period unless they're, there's some other reason. But just trying to understand when you're saying that, so there's two eligibility criteria. One is the age, more than 70 years of age. So if they did receive their dose 28 days or more ago, they would now be eligible for the second dose. Everyone else, typically, they have to have received their first dose by April 18th, and then they would be eligible for the second dose. which would put them more than 28 days ago.
Yes, to be clear, I was talking about the general population, not 70 plus or anyone who is eligible for vaccination under that accelerated criteria.
Yeah, so that's not the direction right now from the province, that regardless of age or eligibility, that 28 days and more are eligible. That's not the direction. So we'll have to see who believes that is occurring, because it shouldn't.
Thank you very much.
Okay, thank you, everyone. Have a good weekend.